some things that have surprised me is how I've heard on the conference circuit for my whole career, basically, that how regional health care is, how regional health is. But what surprised me is health is one of the few things that's actually universal, right? It impacts all humans, it impacts all of us. We all need health and health care. So there is also a great universality of what's truly needed. Yes, regulations are different. Yes, cost structures are different. Delivery mechanisms need to be different. So while there's this very fragmented reality globally, there's also, I think, a lot of opportunity to learn in a global sense. And what surprised me is how rare that is to see anyone in the healthcare world or market thinking this way. We are seeing it in banking. We're seeing it in e-commerce. We're seeing it in internet. So I think you're starting to see some of the large technology companies think this way. These now trillion-dollar plus companies like Apple or Amazon, because if you're a $3 trillion company, there's only a couple ways to become a $5 trillion company or a $6 trillion company. And it's going to be, I think, global thinking. And it's just surprised me at how rare that is in the healthcare landscape.